Good morning, everyone. This is Jonathan Kaiser. I'm with the Office of Emergency Preparedness here at VDH. I'm going to give you a quick overview of some of the planning changes that have occurred in light of the COVID-19 pandemic. So VDH has developed some interim guidance for disaster shelters to assist with state and local planning efforts. This guidance document is based on current information about the transmission and severity of COVID-19, and it's largely modeled after guidance provided to us by the CDC. So CDC and VDH will continue to update this guidance as additional information becomes available. The VDH interim guidance for disaster shelters during the COVID-19 pandemic document is really intended for use by local jurisdictions and state agencies that are involved in mass care operations during emergencies or disasters. So the ultimate goal of the guidance is to assist shelter staff in taking appropriate actions for reducing the possibility of transmission among staff, volunteers, residents, and visitors. And the guidance should be used in conjunction with existing shelter operation and management plans and is not intended to be a substitute for routine shelter planning and preparedness activities. As you all know, individuals housed in shelters share living spaces and sanitary facilities, and they may be exposed to crowded conditions. So it's really important for emergency managers, shelter managers, and public health professionals staffing shelters to understand the risk of transmission in these settings. So the keys to preventing COVID-19 from spreading in any group are keeping a distance of at least 6 feet between individuals at all times, rapidly identifying onset of symptoms compatible with COVID-19 and isolating anyone with those symptoms, and promoting frequent hand washing and good hygiene practices. So each shelter manager plays a key role in continuously assessing the health of staff and clients and implementing measures to prevent disease. So it's important for shelter managers to keep up with the latest guidelines from VDH and the CDC as information changes rapidly. And because conditions vary from community to community, shelter managers and emergency management officials are encouraged to work closely with their local health district for the latest information specific to that locality. Whenever possible, alternatives to opening disaster shelters, such as sheltering in place, should be considered. Hotels, motels, and small shelters should be prioritized over larger shelters, and with large shelters being used as a last resort. If established, large shelters should be demobilized as soon as possible after the emergency phase, and residents should be relocated to hotels or smaller shelters for better social distancing. It's important to note that access to safe shelter from disasters is critical even during community spread of COVID-19. So disaster shelters should not exclude as residents people who are having symptoms or test positive for COVID-19. The VDH interim guidance for disaster shelters during the COVID-19 pandemic document is available on the VDH internal website at this link. The guidance includes detailed information on shelter intake and registration, screening, monitoring, and isolation, health information and education, social distancing recommendations, environmental health recommendations, SARS-CoV-2 testing and shelter settings, and special considerations for children, as well as prescriptive public messaging and screening tools. The Virginia Department of Social Services and Virginia Department of Emergency Management also have sheltering guidance documents that are available at the same link. So during the COVID-19 pandemic, the Virginia Emergency Support Team will continue to support localities through the implementation of the state-coordinated regional shelter plan for events that meet the activation requirements outlined in that plan. Some of you may know this type of sheltering referred to as state-managed shelters. Traditional state-coordinated regional shelter sites typically include large university buildings such as gymnasiums. However, the 2020 plan update includes a non-congregate sheltering solution in addition to the traditional congregate sheltering solution. This approach involves housing individuals and families in hotel or motel rooms when they do not have the ability to seek shelter safely with a friend or family member. The Virginia Department of Social Services is actively preparing contracts with private industry partners, and additional information will be shared with localities when it's available. So when life-saving mass care operations are necessary, the first priority is, of course, the movement of individuals to safety. State shelter partners will make every effort to implement current public health guidance, but operational decisions will be made based upon immediate threats to life and safety. So the non-congregate sheltering option does not mean that congregate shelters will never have to be activated. This table shows the various options for state-coordinated regional shelters that may have to be implemented this hurricane season. The preferred option, of course, is to place all evacuees requiring assistance in non-congregate shelter settings, such as hotels and motels. However, it is possible that both non-congregate and congregate options may need to be utilized. In this scenario, individuals and family groups would be screened by Department of Social Services staff to determine the best placement option for them. In an emergency event with no notice, it may be necessary to move individuals to a safe congregate location until non-congregate options can be identified. The Virginia Department of Social Services intends to establish a call center to support residents when that plan is activated. The call center staff will be responsible for verifying, screening, and assigning evacuees to the appropriate shelter location, as well as determining any transportation needs. So although non-congregate sheltering provides conditions similar to home, wraparound services must be provided to include linens and personal hygiene items, janitorial services, meals and hydration, health and behavioral health support, access and functional needs support, translation services, and other needed services. So the majority of these services will be provided virtually through request to the call center by the resident. If necessary, the call center will then transfer these calls to the appropriate state agency to review and fulfill the need.